You're about to take on a 5-hour NCLEX RN challenge that simulates real exam pressure. Inside, you'll face complex case studies, clinical judgment scenarios, tricky SATA traps, timed decision-making, safe dose calculations, highlight and drag and drop questions. But here's the twist. We're not just testing you. We're training your brain to think like the NCLEX wants you to. After every question, we break down the logic, the traps, and the best test-taking tactics, step by step. Why is this different? Because you won't just memorize, you'll master. You'll stop second-guessing, you'll know why you're right and exactly where you went wrong. Let's build the kind of confidence that walks into the testing center and walks out licensed. Let's go. Now let's talk about basic care and comfort, a core part of what nurses do every day, especially for clients with limited mobility. Question: a nurse is providing basic care to a client with limited mobility. Which interventions promote comfort and hygiene? Select all that apply. Here are the options given to you on the screen. 1. Reposition the client every 2 hours to prevent pressure ulcers. 2. Provide oral care every 4 hours for a client on a ventilator. 3. Administer pain medication 30 minutes before physical therapy. 4. Allow the client to skip daily bathing to conserve energy. 5. Use a draw sheet to assist with turning the client. 6. Encourage high-calorie snacks to promote weight gain. Please take your time or pause the video if you want to carefully think through your choices. All right, let's walk through them together. Option 1. Reposition the client every 2 hours to prevent pressure ulcers. Yes, this is standard evidence-based care for clients with limited mobility. Repositioning every 2 hours helps prevent skin breakdown and promotes comfort, a foundational part of nursing care. Option 2. Provide oral care every 4 hours for a client on a ventilator. Absolutely. Ventilated clients are at a higher risk of infections, like ventilator-associated pneumonia. Regular oral care helps prevent that and promotes hygiene and comfort. Option 3. Administer pain medication 30 minutes before physical therapy. Yes, this is a smart, proactive intervention. Giving pain meds ahead of therapy helps the client tolerate movement and get the most out of their session while staying comfortable. Option 4. Allow the client to skip daily bathing to conserve energy. Not ideal. While we want to respect the client's energy levels, daily hygiene is still important for infection prevention and skin health. There are ways to adapt the routine without skipping it altogether. Option 5. Use a draw sheet to assist with turning the client. Yes, again. A draw sheet not only makes it safer for the nurse, but also reduces friction and shear on the client's skin, making repositioning more comfortable and protecting skin integrity. Option 6. Encourage high-calorie snacks to promote weight gain. Not necessarily. Nutrition is important, but pushing high-calorie snacks without a proper nutritional assessment might not be appropriate, especially if the client has other conditions like diabetes or cardiac issues. So your correct answers are 1, 2, 3, and 5. Remember, when caring for clients with limited mobility, focus on skin protection, comfort, pain control, hygiene, and safety.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
Let's break down this practical question together. A nurse is preparing to administer medication to a patient. The physician has ordered 500 milligrams of a drug, but the medication is available in 250 milligrams tablets. Which of the following actions are correct when preparing the medication? Select all that apply. Here are your options. A, administer 2 tablets. B, administer 1 tablet. C, double-check the medication order. D, crush the tablets before administration. E, ensure the patient can swallow the tablets. Take a moment to read through these carefully. Think about the dosage, the form of the medication, and the safety steps. You can pause the video here if you need a little more time. All right, let's talk it through, one option at a time. Option A, administer 2 tablets. Yes, that's absolutely correct. If each tablet is 250 milligrams and the doctor ordered 500 milligrams, you need to give, 2 tablets. It's basic math, but also essential for accurate dosing. Option B, administer 1 tablet. Nope, not this one. 1 tablet is only 250 milligrams, so that's only half the prescribed dose. Giving just 1 would mean the patient doesn't get enough medication, and that can affect their treatment. Option C, double-check the medication order. Yes, yes, yes. Even if the math seems easy, always double-check. Make sure you've got the right medication, the right dose, the right route, and the right patient. It's a simple habit that can prevent serious errors. Option D, crush the tablets before administration. Not this one, unless it's specifically allowed. Some medications should not be crushed because it can change how they're absorbed or even cause side effects. Always check the manufacturer's guidelines or pharmacy instructions before doing this. Option E, ensure the patient can swallow the tablets. Yes, this is an important safety step. Before giving any oral medication, make sure the patient can safely swallow. If they have difficulty, you might need an alternative form, like a liquid, but always assess first to avoid choking or aspiration. So the correct actions here are A, administer 2 tablets. C, double-check the medication order. E, ensure the patient can swallow the tablets. A 35-year-old female patient has been recently diagnosed with breast cancer. She is experiencing feelings of overwhelm, fear of treatment, and difficulty sleeping. She mentions that she used to enjoy painting and spending time with friends, but hasn't engaged in either activity since her diagnosis. Question. Based on the patient's emotional state, what coping strategies should the nurse encourage to help manage stress and promote her psychosocial well-being? Take a moment to consider this. The correct answers are expressive activities like painting, social support from friends, relaxation techniques. Now, let's go through each answer in detail. 1. Expressive activities like painting. The patient used to enjoy painting, but since her diagnosis, she hasn't been engaging in this activity. Expressive activities like painting are powerful coping strategies for individuals dealing with stress and emotional turmoil. They allow the patient to express her emotions and reduce the overwhelming feelings of fear and anxiety that often accompany a cancer diagnosis. Since painting was a past interest, Encouraging her to return to this activity could provide a positive outlet for her emotions. 2. Social support from friends. The patient mentions she used to spend time with friends, but now she's isolating herself. Social support is one of the most important coping mechanisms for managing stress. Reconnecting with her social network, whether through friends, family, or support groups, can provide emotional encouragement, reduce feelings of isolation, and help her feel understood and less alone. This support is essential for improving psychosocial well-being and resilience during difficult times. 3. Relaxation techniques. The patient is having difficulty sleeping, which is often tied to anxiety and stress. Relaxation techniques like deep breathing exercises, progressive muscle relaxation, or guided imagery can help manage anxiety and improve sleep quality. These techniques promote calmness and help the body and mind relax, especially when overwhelmed by negative emotions and stress. They can also foster greater resilience as the patient navigates her treatment. Now let's look at the other options. Avoidance of emotions. Avoiding emotions can worsen stress and prevent the individual from processing and managing their feelings in a healthy way. It can lead to emotional numbness and further isolation, preventing healing. Excessive alcohol use. Turning to alcohol or other substances is a maladaptive coping strategy. While it may provide temporary relief, it ultimately worsens emotional and physical health. Excessive alcohol use can increase anxiety, depression, and interfere with sleep. Confrontational arguments. Engaging in confrontational arguments would increase tension and emotional distress, making it harder to manage stress effectively. Arguments could harm relationships, which are essential for social support. Overscheduling daily tasks. While keeping busy can sometimes be helpful, overscheduling can lead to increased stress, exhaustion, and further emotional strain. It's important to maintain a balance and avoid overburdening oneself. In short, for this 35-year-old patient newly diagnosed with breast cancer, the nurse should recommend expressive activities like painting to provide an emotional outlet and promote self-expression. Social support from friends to reduce feelings of isolation and encourage emotional resilience. Relaxation techniques to improve sleep and reduce anxiety. These strategies are supportive and can help improve both her psychosocial well-being and ability to cope with the stresses of her diagnosis and treatment.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a take-in for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.
A nurse is counseling a 50-year-old man with a family history of colorectal cancer during a routine wellness visit. Here's what we know. The patient smokes 1 pack of cigarettes daily. His diet is low in fiber. Now, the nurse is considering a few possible interventions. Discuss smoking cessation. Schedule a colonoscopy. Teach about a high-fiber diet. Recommend a daily multivitamin. Now let's see the answer. B. Schedule a colonoscopy. Explanation. This question falls under the health promotion and maintenance category. The focus is on disease prevention, specifically colorectal cancer. At age 50, with a family history of colorectal cancer, the patient is at a higher risk. And here's the thing. Screening for colorectal cancer is key to early detection. It can even prevent cancer by removing precancerous polyps before they develop into full-blown cancer. Here's why the colonoscopy is the most effective intervention. Gold standard. A colonoscopy is the gold standard for screening colorectal cancer, especially for someone with risk factors. Early detection. This test helps identify early-stage cancer or precancerous growths, like polyps that can be removed during the procedure itself. Guidelines. The American Cancer Society recommends screening starting at age 45 or earlier for those with family history, making this the most critical intervention for this patient. Now let's quickly go over the other options. A. Discuss smoking cessation. While smoking does increase the risk for several cancers, including colorectal cancer, it's not as directly impactful on colorectal cancer as screening is. Smoking cessation is essential for overall health, but the colonoscopy is more directly related to colorectal prevention. C. Teach about a high-fiber diet. A high-fiber diet is a great long-term strategy to lower the risk of colorectal cancer, but it's not as immediately impactful as screening for early signs of cancer or precancerous conditions. It's something to incorporate, but screening is more urgent given the patient's risk factors. D. Recommend a daily multivitamin. There is no strong evidence linking multivitamins with reducing colorectal cancer risk. While they're useful for general health, they do not play a significant role in colorectal cancer prevention. Key takeaway. For a patient like this, early detection through a colonoscopy is the most effective intervention to prevent colorectal cancer. The NGN emphasizes evidence-based prevention, and in this case, screening is the priority. Imagine this. A 58-year-old male with a history of COPD and hypertension comes to the emergency department ED. He's been feeling worse over the past few days, more shortness of breath, chest tightness, and an increase in his yellow-green sputum. He's been using his albuterol inhaler at home, but today he says it's not helping. That's a red flag, isn't it? Now, it's 10 a.m., and during your assessment, things get more concerning. He becomes more dyspneic, meaning he's struggling to breathe, and now he's anxious as well. Let's look at his vital signs. Blood pressure, 150/92, a bit high. Heart rate, 118 BPM elevated, likely due to his breathing struggle. Respiratory rate, 32 breaths min, rapid breathing, and it's shallow and labored. Oxygen saturation, 86% on room air. That's low, indicating hypoxemia. Temperature, 100.8, suggests possible infection. Assessment data. His lung sounds reveal diffuse wheezing and diminished breath sounds in the lower lobes. His skin feels cool and clammy, and there's cyanosis, bluish discoloration around his lips, another major concern. Despite all this, he's still alert, but noticeably anxious and struggling to finish sentences. Lab values. ABG, arterial blood gas, shows pH 7.3D, acidic, indicating respiratory acidosis. PaO2 50, elevated CO2, common in COPD exacerbation. PaO2 60 mm, low oxygen level. HCO3 24, normal, meaning his body hasn't yet compensated. His WBC count is 13,500 mm, indicating possible infection. The chest X-ray shows hyperinflation of the lungs, but no consolidation, meaning there's no clear sign of pneumonia. Medications. At home, he's been taking his albuterol inhaler and lisinopril for blood pressure. In the ED, the doctor has ordered oxygen via nasal cannula, an albuterol ipratropium nebulizer, prednisone 40 milligrams to reduce inflammation, IV antibiotics, likely to manage the suspected infection. Now that we've gone through the scenario, I'll be giving you 6 important questions based on this case. Each question will test your understanding of prioritization, delegation, and appropriate nursing actions. Take a moment to review the details, and we'll jump into the questions next. Ready? Question 1. Recognize cues, multiple choice. Which of the following findings should the nurse identify as the most critical indicator of an acute physiological change requiring emergency response? A. Oxygen saturation of 86% on room air. B. Heart rate of 118 BPM. C. Cyanosis around the lips. D. Respiratory rate of 32 breaths min. Take a moment to think carefully about which of these is the most urgent sign. Answer. The correct answer is C. Cyanosis around the lips. Explanation. A. Oxygen saturation of 86% on room air. While this is certainly concerning and requires intervention, it's a number, and numbers can sometimes improve quickly with oxygen support. Cyanosis, however, shows that the tissues are already deprived of oxygen. B. Heart rate of 118 BPM. This is an elevated heart rate, but it's the body's natural response to compensate for low oxygen, not the most immediate danger. C. Cyanosis around the lips. This is the correct answer. Cyanosis is a visible sign that oxygen is no longer reaching the tissues effectively, a critical emergency that must be addressed immediately. D. Respiratory rate of 32 breaths min. Rapid breathing reflects distress, but cyanosis is a stronger indication that the body is actively failing to oxygenate. So remember, when you see cyanosis, especially in someone with respiratory issues like COPD, treat it as a red flag that demands immediate intervention. Question 2. Analyze cues, multiple response. Select all that apply. Which of the following findings should the nurse associate with an acute exacerbation of the client's chronic COPD? A. Diffuse wheezing. B. PaO2 of 50 mm. C. Increased sputum production. D. Temperature of 100.8. E. Blood pressure of 150 to 92 mm. Think about the signs that point to a worsening COPD condition. Select all that apply. Answer. The correct answers are A, B, C, and D. Explanation. A. Diffuse wheezing. Correct. Wheezing shows that the airways are tight and obstructed, which is common in COPD exacerbations. B. PaO2 of 50 mm. Correct. In COPD, the lungs struggle to remove carbon dioxide, and this elevated value confirms that CO2 is building up, worsening the condition. C. Increased sputum production. Correct. This is a classic sign of an exacerbation, especially when sputum becomes thicker or changes color, like yellow-green. D. Temperature of 100.8 degrees. Correct. A fever suggests possible infection, which is a common trigger for COPD exacerbations. E. Blood pressure of 150/92 mm. Incorrect. Although this is elevated, it's unrelated to the acute COPD episode. Hypertension is a chronic issue. So when you assess a COPD patient with worsening breathing, think about signs like wheezing, elevated CO2, increased sputum, and fever. All of these strongly point to an acute flare-up. Question 3. Prioritize hypotheses. The nurse is considering potential complications. Rank the following conditions from most likely, 1, to least likely, 3, based on the client's presentation. Acute respiratory failure, pneumothorax, acute myocardial infarction. Pause here and rank them before checking the answer. The correct order is 1. Acute respiratory failure, 2. Pneumothorax, 3. Acute myocardial infarction. Explanation. 1. Acute respiratory failure. This is the most likely complication. The low oxygen level, PaO2 60 mm, high CO2, PaCO2 50 mm, cyanosis, and respiratory distress all point toward the lungs failing to provide sufficient oxygen, a clear sign of respiratory failure. 2. Pneumothorax. This is possible since COPD patients are at higher risk due to weakened lung tissue, but the absence of sudden chest pain or absent breath sounds makes this less likely than respiratory failure. 3. Acute myocardial infarction. Although chest tightness could suggest a heart issue, the patient's wheezing, sputum, and ABG findings align much more with a pulmonary cause. When prioritizing complications, always start by asking, is there an immediate threat to breathing? What's the most urgent risk based on the patient's condition? In this case, respiratory failure is the clear frontrunner. Question 4. Generate solutions. The nurse is initiating an emergency response. Select the most appropriate initial intervention for this client. Apply oxygen via nasal cannula at 2 lobe min. Administer albuterol protropium nebulizer. Position the client flat in bed. Prepare for immediate intubation. Take a moment to decide what you would do first in this situation. The client's SpO2 of 86% and cyanosis indicate urgent hypoxemia, so your first step should be to improve oxygenation. Since the patient has COPD, low-flow oxygen is ideal to avoid worsening CO2 retention. Administer albuterol ipratropium nebulizer. Incorrect. While this medication is important to open the airways, it should follow oxygen administration. Hypoxemia must be treated immediately. Position the client flat in bed. Incorrect. Lying flat can worsen breathing difficulties. Instead, the client should be positioned in semi-Fowlers or high Fowlers for optimal lung expansion. Prepare for immediate intubation. Incorrect. Intubation is a last resort when other measures fail. First, try less invasive interventions like oxygen therapy and bronchodilators. In respiratory distress cases like this, always start by addressing the airway and oxygenation first. That's the priority. Question 5. Take action, hotspot. The nurse is assessing the client's respiratory status during the emergency response. Click on the area of the body where the nurse should auscultate to evaluate wheezing. Anterior chest, posterior chest, abdomen. Think carefully. Where would you get the most accurate assessment of breath sounds? Answer. The correct answer is posterior chest. Explanation. Posterior chest, correct. Auscultating the posterior chest allows you to assess the lower lobes, where breath sounds were noted to be diminished. This is crucial for detecting wheezing or other abnormal sounds. Anterior chest. Incorrect. While you can hear upper airway sounds here, the posterior chest provides a more comprehensive assessment of lung fields, especially for COPD patients with lower lobe involvement. Abdomen. Incorrect. This is for assessing bowel sounds, not respiratory status. In patients with COPD exacerbations, the posterior chest is your best spot for detecting airflow issues like wheezing or crackles. Question 6. Evaluate outcomes, matrix. After 30 minutes of oxygen at 2 L/min and an albuterol ipratropium nebulizer, the nurse reassesses the client. Indicate whether each finding suggests effective management or ineffective management of the acute condition. SpO2 increased to 92%, wheezing decreased, RR reduced to 24 breaths min, client reports less chest tightness. Pause and reflect on each outcome. What would show improvement? Answers. SpO2 increased to 92 effective. Improved oxygen saturation from 86% shows that oxygen therapy is successfully addressing the client's hypoxemia. Wheezing decreased. This indicates that the bronchodilator, albuterol ipratropium nebulizer, is opening the airways and improving airflow. RR reduced to 24 breath-flirt min. effective. A decrease in respiratory rate from 32 to 24 signals improved breathing efficiency and less distress. Client reports less chest tightness, effective. This subjective improvement confirms that treatment is working to reduce airway obstruction and discomfort. All 4 outcomes indicate that the interventions have been successful. When assessing outcomes, remember to look for improved oxygenation, decreased respiratory effort, and relief of symptoms. These are your key signs that care is effective.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the next-gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next-generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
A 66-year-old male's ECG reveals a regular rhythm, heart rate of 110 BPM, and narrow QRS complexes. The patient reports anxiety and recent caffeine use. What is the most likely rhythm? A. Supraventricular tachycardia, SVT. B. Ventricular tachycardia, C. Sinus tachycardia. D. Atrial flutter. Correct answer, C, sinus tachycardia. Let's break it down. The rhythm is regular, the QRS is narrow, and the rate is just above 100. Combine that with anxiety and caffeine, and we've got a picture-perfect example of sinus tachycardia. C is correct. It's the body's normal response to stress or stimulants like caffeine. ASVT usually has a faster rate, 150 to 250 BPM, and may start or stop suddenly. B. Ventricular tachycardia would show wide QRS complexes, which we don't have here. D. Atrial flutter would show sawtooth flutter waves, not regular P waves like in sinus tach. This one's likely just too much caffeine and stress, but always rule out more serious causes if symptoms persist. All right, class, let's talk about fall prevention, something we deal with all the time in clinical settings, and a frequent flyer on the NCLEX. Here's your question. A nurse is caring for a client at risk for falls. What is the most effective intervention to prevent injury? Your options are A. Keep the client's bed in the highest position for easy access. B. Ensure the call light is within the client's reach at all times. C. Restrain the client during the night to prevent wandering. Place a chair in front of the client's bed to block movement. Pause and think about it. You're on the unit, you've got a fall risk patient. What's going to truly keep them safe and respect their rights? Let's look at the options one by one. Option A, keep the client's bed in the highest position for easy access. Oof, this sounds like a setup for a disaster. We never want the bed in the highest position for a fall risk patient. If they try to get out, that's a long way down. The correct practice? Keep the bed in the lowest position. Easier and safer if they do try to get up. Option B, ensure the call light is within the client's reach at all times. Yes, this is the correct answer. Why? Because this promotes independence with safety. If the client can call for help when they need to get up, they're less likely to try and do it on their own, which reduces fall risk significantly. It's practical, respectful, and super effective. Simple things like this make a huge difference in safety outcomes. Option C, restrain the client during the night to prevent wandering. Whoa, stop right there. Restraints? That's a last resort. Not only do they require a doctor's order, but they can increase agitation, lead to injury, and compromise the patient's dignity. We don't jump to restraints. We try alternatives first. Option D, place a chair in front of the client's bed to block movement. Creative? Maybe. Safe? Absolutely not. This could easily become a tripping hazard, not to mention it doesn't address why the patient might want to get out of bed. We want to work with our patients, not set up barricades. NCLEX tip: when you see questions about fall prevention or safety, think, what keeps my patients safe and supports their independence? That's the sweet spot. And in this case, it's as simple and powerful as keeping the call light within reach.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.